Okay, thanks for waiting, everyone. Good evening, and welcome to Postgraduate Training Opportunities in Community Pharmacy and Independent Ownership, the final of 3 web meetings in NCPA's Future Pharmacist webinar series. My name is Alexander Tu, and I am the NCPA Executive Resident. I will be your host for today's call. Before we get started, I wanted to let you know that this evening's web meeting is being recorded. The slides and recording should be available within 5 business days at www.ncpanet.org/residency. Community pharmacy residencies are emerging as a key experience for many new graduates, and NCPA is here as a resource to help you find information you need. A new portion of our residency page on our website is being developed and will be available for you to use during your residency search, so watch for that in the next few weeks. Tonight, we brought together 4 community pharmacy residents from across the nation to share their experiences so far. Without further ado, let me introduce our panelists. Dr. Stephanie White is the community pharmacy resident at South Carolina College of Pharmacy and is a graduate of Mercer University College of Pharmacy. Next, Dr. Nick Dominic is the community pharmacy resident at University of Charleston and graduated from Duquesne University School of Pharmacy. We also have with us Dr. Alex Brewer, who is the community pharmacy resident at the University of Kentucky College of Pharmacy. And Dr. Brewer also graduated from UK College of Pharmacy. Finally, Dr. Kripali Patel is the Independent Pharmacy Ownership Resident through the UNC Eshelman School of Pharmacy and is a graduate of MCPHS University School of Pharmacy. In addition, joining us tonight are the UNC Independent Pharmacy Ownership Residency Co-Directors, Dr. Stephanie Ferrari and Dr. Patrick Brown. And with that, I'll turn things over to our residents for a brief presentation followed by a moderated discussion. We have reserved the final 10 minutes for question and answers, so be thinking about what things you may want to ask our panelists. Stephanie, why don't you get us started?
All right. Hi, everybody. Thanks for taking time out of your day to come. My name is Stephanie. I'm the PGY1 community resident at Mart Pharmacy. So a little bit about our pharmacy. We opened up in 1982, and our residency for next year will be entering its 5th year, so I'm currently the 4th community resident. And overall, working at the store, we have 2 full-time pharmacists, 2 technicians, myself, or possibly you, several students working at a time, and then there's 2 part-time pharmacists as well, and our hours are 9 a.m. to 6 p.m. Monday through Friday and 9 to 1 on Saturday. As a resident, you come in between like 8:30 and 8:45 and would go until 6 Monday through Friday, so you don't have to work any of the weekends, which is awesome. Okay, so several of our services at Medicine Mart, we offer a variety, which makes it super exciting. There's the medication synchronization is something I've been able to get up and going this year, and that's the focus of my residency project, is enhancing that and watching its growth and monitoring its profits as well for the pharmacy. You also do a lot of comprehensive medication reviews through using Outcomes, Marixa, and then sort of as needed for patients, which happens more often than you would think. There's also educational classes, so you'll design the curriculum and do all of the promoting with students help to promote it, so that's always exciting. In January, we're starting the diabetes prevention program, so that's through the CDC. And we also have a blood pressure coaching program, and so the way that works is it's funded through a grant with the South Carolina Pharmacy Association and DHEC, and you actually meet with patients one-on-one, and you meet 5 times over the course of about a 6-month period, and you can either go to their home or they can come to you in the pharmacy, and you counsel them on nutrition, stress, medication management, and really just cater the program to them. So that's very fun. You'll be involved with a wide variety of vaccinations, so flu, pneumonia, Tdap. You can do all of those without, and shingles. You can do all of those without prescriptions. We're also getting started right now with pharmacogenomics, so you'll be able to be a certified educator, and currently we'll be the only ones in South Carolina offering this. So we're very excited. We also offer adherence packaging for some of our elderly patients, free delivery of medications, wellness screening. So we partner with students from the South Carolina College of Pharmacy to do blood pressure and glucose and BMI screenings the second and fourth Wednesday of every month. But then you'll also set up screenings within the community and do them at several assisted living facilities as well. And same with flu shots. You'll set up flu clinics and other vaccination clinics. We offer flavored medications, and then something I started this year is we're actually incorporated into one of the local preschools' curriculum. So every Friday I go over there for about an hour and teach 2 to 4-year-olds different health topics, and so that's also very exciting. And then there's also other opportunities. So you have the option of getting a teaching certificate through the University of South Carolina with their academic preparation program. So that's one of the things I like about the residency is the opportunity to teach, and you do a lot more of the teaching in the second half of the residency program. You do a little in the fall as a warm-up. There's also the Kennedy State Pharmacy Innovation Center, which is a great resource for learning HR skills, business, some of the ownership side, and really just helping to make pharmacy. If you had an innovative service idea, they can help you determine how much it would cost, help you create the business plan. So they're a really great resource. You also have access to all the university resources. You can go to all of the football games and get tickets. You're also their APHA ASP chapter new practitioner mentor, which is something I've loved. Tons of networking opportunities through things such as going to drug rep dinners, various conferences. I've met more people than I could have imagined in just the first few months of this residency. You'll also take part in different book and journal clubs with our residency director and other preceptors. So that's a great opportunity to learn. And then you'll mentor pharmacy students through precepting them or assisting with precepting them. So I'm currently precepting a student right now, so that's a highly rewarding experience. So in terms of how to apply, it's just through forecasts, and the application deadline is January 15th, and it requires the transcript, your CV, 3 letters of reference, your letter of intent, and of course the application. And then with South Carolina, we actually have another site in Augusta, Georgia with Barney's Pharmacy. So you can see more information about that on the website listed on the slide. And then if you have any more information about Medicine Mart, you can go to that website or email me at medicinemartresident@gmail.com. And so I'm actually going to have to hop off the call early for another commitment tonight. So please don't hesitate to ask me any questions if y'all have any. But thank you again.
All right. Thank you so much, Stephanie. Next, I'll turn things over to Nick Dominic with Fruth Pharmacy in the University of Charleston in West Virginia to talk about their residency program.
Good evening, everyone. So my name is Nick. I am the PGY1 resident with Fruth Pharmacy and the University of Charleston in West Virginia. I have noted here, too, that there are also aspects of academia and ambulatory care as part of my residency. We've been ASHP accredited under Fruth Pharmacy for a year, so I'm the first resident with the ASHP accreditation, and we currently offer one position. A little background about Fruth Pharmacy. So we are currently a growing independent chain. We have 29 stores located in West Virginia, Southern Ohio, and Kentucky. And we also have a pharmacy located in a mental health facility as well. And the University of Charleston is in Charleston. So the core elements to the residency program, we have the community and clinical pharmacy. So that's really taking place in the patient care center that we have. A lot of the time that entails precepting students, working in outcomes in Marixa, MTM platforms. And then we also have a lot of point-of-care testing programs. So residents are, responsible for doing a lot of immunization clinics. I go around and travel a lot to do flu clinics at a lot of different sites. We also have a new restructuring of our MTM processes, which is one of the primary things that I'm working on. We also have had hepatitis C grants from NACDS and now Gilead to provide hepatitis C testing, and that's also synced up with our specialty pharmacy program. Obviously, we have a lot of hep C medications that accompany that. And we also are offering pharmacogenomic testing. I was actually featured on the local news a couple days ago, and I will be teaching about pharmacogenetics next semester. So that is another up-and-coming service that we are now providing, and we're hopeful about that. So that's an example of a couple of the different things that we do in terms of the clinical pharmacy. Another day per week you're going to spend in a retail. That's really just fulfilling the retail operations, and a big focus of my residency in terms of the dispensing aspects are how to really coordinate clinical services into the normal workflow at the retail level. One day a week is also committed to academia, and this includes lecturing in pharmacotherapy courses, which is generally up to the residents, so that's a really good advantage of that, is that you get to pick a lot of different courses that you want to teach. You also coordinate top 200 drug courses and medical terminology, and you also participate in proctoring and coordinating labs as well. And then lastly, one day a week I spend in an ambulatory care site, which is a family medical practice with a University of Charleston assistant professor. We focus on diabetes management. We're actually working on getting a few other things such as smoking cessation and some hypertension management incorporated into our services there as well, which is really fun. The major projects that I work on with my residency are my primary research project, which right now is incorporating opioid management and structuring that into MTM sessions. You're also doing a medication use evaluation. In my AmCare course, I'm working with my preceptor there for a collaborative practice agreement. You work on a lot of quality and safety initiatives, and that accompanies the clinical services like I talked about previously. A nice part about my residency is that we have that management and administration rotation, which takes place in the third quarter of the residency. And what that really entails is sort of taking all of the projects that you've worked on and sort of implementing them in the pharmacy chain as a whole. So like I said, like right now my MTM project is being piloted, and hopefully when I come around to my third quarter management, I'll be able to take that and sort of see how we can make that grow across the chain. And then we also offer a 10 weeks elective, so mine is actually going to be split. Right now we're looking like it's going to be oncology for 5 weeks, and then advanced academia at the University of Charleston for another 5 weeks. I forgot to mention earlier, too, with the academia that we do get a teaching certificate as part of our residency as well, so there are X amount of hours and different teaching activities that will be required as part of that. So resources and applying. I didn't put the date. I don't have the exact date of when the forecast application is due, but our application process is through forecast and includes your standard application materials, so a letter of intent, official transcript of pharmacy coursework, your CV, and then 3 letters of recommendation. And then I've added here the link to our residency website.
Thanks so much, Nick. Next,
Absolutely.
I'll turn things over to Dr. Alexander Brewer to talk about the UK College of Pharmacy and APSC PGY1 program.
Hey, y'all. Thanks for calling and attending tonight. As you said, my name's Alex Brewer. I'm the current resident with the University of Kentucky and American Pharmacy Services Corporation. We also have 2 additional sites through Kroger. I'm just going to be focusing on mine tonight. So APSC is a cooperative of over 400 independent pharmacies. We're headquartered in Frankfort, Kentucky, and you really get to focus with the professional affairs division of APSC, which is mainly looking at implementing, marketing, designing, patient care services, but you also get to participate in the legislative process in Kentucky. So you'll get to network with different legislators, different practice groups within Kentucky that are all focused on trying to advance pharmacy practice. Primary patient care site is at Wheeler Pharmacy. So Wheeler Pharmacy opened in 1958. It's been a staple in Lexington, Kentucky ever since. And this is going to be the primary practice site for all your patient care activities. So at Wheeler, one of the more unique things we do is what we call our home connection program. So this has a really big geriatrics focus. We do weekly adherence packaging and delivery, but we also basically do a weekly MTM. So we're kind of a hub for these patients who are often seeing 6, 7, 8 different physicians, specialists, etc. All the orders that they are on come through us. We evaluate everything with their entire medication regimen, and if we have concerns or things we don't think are going to work, we'll contact the provider and try and work out that issue proactively ahead of time before the patient ever gets the medication. So it's a really good experience with working with other healthcare providers and learning to make recommendations, learning to back up your recommendations, and coming to a compromise or figuring out what's best for the patient. I'm also in charge of the MedSync program, so that's something new I'm starting this year actually, getting that off the ground and getting it running, which has been a really good experience. We do MTM. We're starting diabetes self-management education classes in January 2017, and the resident is also in charge of immunizations, so screening patients, providing immunizations. I've recently been involved with a local primary care group that goes out and performs house calls. They weren't able to provide immunizations this year, so I've been going to patients' homes to provide those, and it's a service they've already said they want to continue next year, so next year's resident will be involved with that as well. Some other things that do with APSC, there's a monthly shareholder newsletter that goes out that you are responsible for writing. You have free reign on whatever topic you want to write about, whatever's on your mind. And through University of Kentucky, you'll get your teaching certificate. You'll teach both a lab and at least one lecture, but you're free to teach as many of those as you please. So if you're really into teaching, they will give you more than one lab or one lecture. But if you're not into teaching, they won't force you to do more than you want to. And then your research project also goes through the University of Kentucky, and they help you out through the IRB process. And so if you've never done research before, they do a really good job of walking you through everything involved. So if you want to find out more information, I've posted a link here. If you just search University of Kentucky Community Pharmacy Residency, you'll bring this page up. Applications through forecasts, I don't know the exact deadline date yet. I know last year it was January 10th, so it'll probably be around that time again this year. Just one thing I wanted to note is there is an additional essay requirement beyond just the normal forecast requirement. So I wouldn't put off the application until too late. Make sure you have enough time to focus on that essay and really flesh out your thoughts.
All right. Thanks so much, Alex. And finally, I'll turn things over to Drs. Ferrari and Brown, as well as Dr. Patel, to talk about the new program that we are helping support at NCPA, the Independent Pharmacy Ownership Residency.
Well, thanks, everybody. Kripali, do you want to go ahead and go first, and then we can jump straight into the slides?
Sure. So, hi, everyone. My name is Kripali, and as mentioned earlier, I am a recent graduate from Massachusetts College of Pharmacy and currently serving as the first independent pharmacy ownership resident at Central Pharmacy and Compounding Center located in Durham, North Carolina. And so at my this residency is a little different in that it is ownership based, and Dr. Ferrari and Dr. Brown will kind of go further into that. But currently, as the independent pharmacy ownership resident, I'm working on a few projects at my site. One of the things that I'm working on is a new service project, which is an accredited diabetes education program. And then I'm also working on a few other projects that will relate more to the ownership program. And for my operations block, I'm working on a medication synchronization project targeting patients with chronic disease states such as diabetes and hypertension. And instead of the traditional research project that goes on with community residency pharmacies, for a future pharmacy that I plan on pursuing, which is a long-term care retail hybrid store.
Alrighty, we will jump right in moving forward then. So as mentioned, my name is Patrick Brown. I am a community pharmacy residency graduate, so I completed the UNC program with Moose Pharmacy back in the 2013-14 year, so I'm very familiar and very supportive with both residency training models. So we'll jump right into a little bit about this program. So as mentioned, this program really exists with the goal to meet the needs of those residents or those graduating pharmacists who are really interested in becoming pharmacy owners. They sort of know that's the path they want to go down, and they just want to spend a residency training year to get as many experiences as they can to get down that path. So you see here our program goals. One is to teach residents innovative and entrepreneurial techniques to be pharmacy owners in an evolving healthcare market. And two, basically to give you the experiences you need to move down that career path. A little bit about the specifics of the program. So we did launch, as Kripali mentioned, for the first this year. So she is our first resident, will be the first of our graduating class. For the 2017-2018 residency year, this is actually, so there are 5 sites moving into next year, so we've grown quite a bit there. Each of these sites that we're going to go over is going to have 1 resident per site for next year. So you'll see this next slide is all of our site locations. So we'll go one by one here, but I'll highlight one note here that may be sort of interesting to look at is that 3 sites in North Carolina, they all partner with Mutual Drug, which is my primary place of employment. We also do have 2 sites outside of North Carolina. And the reason sort of this has come the way it is because this program launched in North Carolina, and it launched in partnership with the UNC Eshelman School of Pharmacy and these individual pharmacies and Mutual Drug. But we really believe that there's a national need for this model to work in partnership with the traditional community pharmacy residency program. So you'll start to see more and more over the years. We're hoping to go out and find partners in other states who are interested in moving into this model. So we'll go one by one a little bit into each of the sites. I don't want to spend a lot of time here just in the sake of time and giving everybody time to ask questions. But so we'll go through these, and then you can find more information about all of these on our Pharmacy Ownership Program website. So the first, as mentioned, Central Pharmacy, which you heard about from Kripali. They have 2 locations in Durham, North Carolina, which is right sort of in the middle part of the state. One location is a traditional community pharmacy. The other is sterile and non-sterile compounding. Of these services here, I would probably note the sterile and non-sterile compounding as well as the education classes as sort of the standout services for this pharmacy. Next is Drug Co Discount Pharmacy. They have 5 locations in eastern North Carolina. So sort of headed, if you're looking at a map of North Carolina, they're more in the northeastern part of the state. You'll see their services there of note. I think they're a full-on DME provider. They also have a specialty pharmacy operation. And also note, the opportunities with a large multi-site location there, some interesting things with that group of pharmacies. Next, ONeills Drugstore, also in eastern North Carolina. You'll see their 4 locations there. They have a very interesting model in their Belhaven store, which you see the picture of on the top left there, and that would be the home site for the resident. They have an embedded clinic in that pharmacy where they offer both primary care and walk-in services with mid-level practitioners. So a lot of opportunity for an ownership resident there to sort of look to learn about that type of business model and think about some new ways to sort of generate revenue and generate new patient care services out of that partnership model. So those are our North Carolina sites for next year. And then the 2 new sites that are outside of North Carolina, the first is Skywalk Pharmacy with 5 locations in Wisconsin. They started with a specialization in pediatric pharmacy, specifically, with a lot of specialty drugs for patients that are in and out of the hospital with, more rare and serious pediatric medical conditions. And they do a lot of really, really high-level services for those patients. So really highlighting probably that service as well as the transitional care things that go along with that, really high level of need from those patients there. And then next is Sunray Drugs with locations both in Philadelphia and in New Jersey. You see some interesting things there. They have specialty operations. They have some HIV and other point-of-care testing things, and also some transitional care partnership programs there. It's also of note that this program has been established really in a 3-way partnership between UNC and sort of this model with Sunray Drugs and their large group of independent pharmacies in that area, and also with University of Sciences and their School of Pharmacy in Philadelphia. So they are involved as well for some precepting opportunities and some resident oversight. I mentioned Mutual Drug. I'll take just a quick moment to speak to our role and how we fit in. So Mutual is a cooperatively owned wholesaler for independent pharmacies in North Carolina, South Carolina, and Virginia. We have, you see there, approaching 600 member pharmacies in 3 states. We are working on a clinical network within pharmacies in our co-op. We also have some opportunities for political advisory or political advocacy opportunities, wholesaling and merchandising, learning more about that world, as well as some things with our PSAO partners. All those opportunities are sort of opened up to the North Carolina residents that are partnered with Mutual stores, as well as learning how Mutual supports new startup pharmacies as they come on board with our wholesaler. So these next couple of slides are really just here to put some faces with names, which is always helpful for me, I know. So you'll see up at the top row, this is our team at UNC, myself, Dr. Ferrari, as well as Dr. Stephen Eckel. And then you'll see the teams there from Central Pharmacy and Drug Co. Those are the preceptors and site coordinators for those sites. And then on the next slide, you'll see some pictures for our partners both at Skywalk Pharmacy. Carlene Melody is at University of the Sciences. She is both the faculty liaison that I mentioned and sort of the site coordinator. She does have a practice at Sunray Drugs. So she's involved both on-site and with the school. And then you'll see the 2 primary pharmacy preceptors for ONeills Drugstore there as well. So that's a little bit about the sites and some of the services. I'm now going to hand it over to Dr. Ferrari to talk a little more about the experience, and then we'll wrap up with how these programs sort of compare to each other, and then hopefully leave plenty of time for questions.
All right. Thank you, Dr. Brown, and thank you, Alex, for having me this evening. This is really exciting. I'm embarrassed to say that Patrick said his graduation year for community residency. Mine was 2001. So I completed community pharmacy residency in 2001, and I've been involved as a preceptor and a residency program director ever since. So I obviously have a huge passion. I'm very excited for all the students on the line. This is a great opportunity, and you're at a great point in your career. So I wanted to talk to you a little about the residency experience for the independent pharmacy ownership residency. And I'm going to talk about compare and contrast also in a little bit compared to the traditional community pharmacy residency program. So on the first slide, I want to share with you the timeline that we have developed for the independent pharmacy ownership program, which Kripauli is currently undergoing. So you can see we have learning experiences, and there's 5 main ones. There's orientation, there's also elective opportunities, but then there's also 5 learning experiences, which we'll go over shortly. And then other learning activities that we have built into the year, since this is focused on, again, future owners, is we have the ownership workshop that's partnering through NCPA. They've been a fabulous partner, and all of our residents are required to go through that ownership workshop. We also have an Essentials Business Certificate, which is through the Keenan Flagler Business School at UNC. So it's an online certificate. So that's why when we have partners in other states, it doesn't matter because it's all online learning that you can do at your own self-pace. So Wisconsin and Pennsylvania will also have the opportunity to do that. So that's another requirement of our program. Other requirements of our program are implementing a new service and planning it, implementing it, and evaluating it. And then doing longitudinal experiences at the practice site, as well as QI projects. We also have monthly to about every 4 to 6 weeks, we have a practice innovation seminar, which is done, again, via phone or via Skype. So that can be done via distance. And then instead of a residency research project, which most traditional residency programs have, instead what we have is we have a capstone business plan. Since the focus of this residency, again, is ownership, really the business plan is focusing on owning or purchasing a new or an existing store. So that's the longitudinal project for residents in this program. So the next slide talks about the learning experiences in a little bit more detail. And so there's 5 main learning outcomes, and these are a little different than your traditional accredited program. So we focus on pharmacy practice, which is similar, but then we really have more of a focus on the finance, the marketing, and the management and operations is also very similar to your typical other program. So this sort of just shows the 5 learning outcomes and then the learning types, whether they're foundational or whether they're experiential. So those foundational ones are, again, the business certificate, the ownership workshop, our seminar, and then the elective experiences. And then within the experiential are the things that you would primarily do at your practice site, the staffing responsibilities, all your patient care services and patient care, direct patient care activities, your QI projects, your new service, your business plan, and then the sites in North Carolina have the opportunity to spend some time with Mutual Drugs. However, through our Innovation and Transformation Seminar, our other practice sites also learn about how to interact with wholesalers as well. So that's another advantage. So I wanted to show a little bit of a comparison. Since this is a relatively new program, like why would you want to do an independent pharmacy ownership residency compared to a traditional community pharmacy residency program? And I was a director of residency program director for a traditional PGY1 accredited CPRP for 11 years, so I have very much experience with that. But I saw an opportunity and a need for many students who wanted to become owners, and they didn't have a traditional pathway to become owners. And so that's what led to the development of this ownership residency program. So this slide sort of outlines the comparison, the compare and contrast. So the learning experiences are listed there, is how we have ours listed for I-4. And then the competency areas is how accreditation calls them out. So with accreditation for CPRPs, you have to have about 65% direct patient care. And you can see within our program, we do have direct patient care as well. However, it's a much smaller number. It's probably closer to 20% compared to 65%. However, you will see that the focus of our program is more that entrepreneurship, that leadership, that management, and that's where developing the business plan and doing the quality improvement projects. That's really where the focus of ours is. So that's just wanted to show a compare and contrast for those of you who might be on the fence and not quite sure which ones to do, I think that's the major difference is probably the management, leadership, entrepreneurship, and the patient care is where the biggest distinction comes in. So I think as you move forward, if you are interested, there's a couple things to think about. We do have a timeline that's different than accredited programs, so we are not an accredited program. So because we're not an accredited program, we do not have forecast applications. So you cannot find us on ASHP or APHA's website since we're not accredited, and you will not find us as the traditional forecast. However, the application requirements are pretty similar. However, we have more of a rolling application deadline, whereas we like to begin interviews in December, and we have sort of applications begin being accepted in middle of November. So today, tomorrow, we'll accept your application. And the applications at this point would be your cover letter, your CV, the application of which sites are you interested in. And then we can begin interviews. And then closer to mid-January is when we would want officially your letters of recommendation, your transcripts. That's when we would need those by. But we don't require those before the interviews come in because really we need to have all the interviews concluded by about mid-February so we can make offers. Because we recognize since we're not part of the forecast and we're not part of the match, we want to make sure that our offers are extended for the IPOR program before you have to put in your rank submission deadline because that you have to decide whether you want to go with an accredited program through the ranking process or match process, I should say, and you have to submit your ranking list or preferences. And we like to make sure that you have the full disclosure of whether you'll have the offer or not. So the application requirements on the next slide, you can find everything on our website. We have on pharmacy.unc.edu/IPOR that has a list of all of our sites like Patrick went over before, our requirements, and the transcripts. An unofficial transcript is fine, and it's just the School of Pharmacy. Sometimes I get those questions of, does it have to be your undergrad too? For us, no, just School of Pharmacy and unofficial is fine. And send the materials directly to me since we're not part of forecast. And for the University of the Sciences in Philadelphia, the Sunray site, they have a direct application also. So that would be, if you're interested in the Philadelphia site in particular, you would send your application right to that website listed there, or for any of the other sites, you would send it directly to me. So hopefully that gave you another option sort of the different types of residency programs out there. I know that many community residency programs have evolved, and the independent pharmacy ownership residency program is just another option for students who have more of the entrepreneurship mindset or are thinking maybe of ownership in the future. So with that, I guess, Alex, I can turn it back over to you so that you can begin the panel session.
Great. Thank you, Dr. Ferrari. Well, thank you to our directors and also all of our residents that joined us tonight. I know that a couple of them, Dr. White and Dr. Patel, had to take off, but the rest of the panel is still here. So let me just see if there's any questions queued up here, and then we'll go into the discussion portion. This question is for the IPOR program. What type of person would the ownership residency be best for? Those with no exposure to pharmacy ownership or those with lots of exposure?
I'll chime in there first, and Stephanie, please, fill in the gaps, if you do. I don't know that the level of exposure is necessarily what would dictate the type of person. I think it's really the desire and the interest and the goals that would lead to you being, the right person for the program or not. Because the whole point of this program is that we recognize that 4 years of pharmacy school is great to teach you to be a medication expert, but it's not great to teach you to run a business. And so as long as it was a person who was interested in that career path and has the skills and the personality and the drive and, sort of the risk-taking sort of mindset to go out there and figure it out on their own, I think that's more important than having previous exposure to independent pharmacy.
I would agree 100%. It's not the experience, it's more what you want to do after the residency. That's more important.
Thank you. The next question is for Nick. Nick, you had mentioned that you were choosing to do an oncology elective. Is that inpatient or an outpatient experience?
So that is going to be an outpatient. We haven't gotten too much more into the details of it. The cool thing about the electives that we offer is that you can really pick anything, and then we'll just sort of figure out where we can go from there. And initially, I was going to be doing a advanced management rotation, but we had a change in some of our personnel, and I leaned back towards doing a more clinical elective.
Thanks, Nick. We've got another question back on the IPOR program. Are there any plans to expand the ownership opportunities to the North Carolina mountains, including Asheville?
You want me to take that one, Patrick?
Sure.
I would say that we're looking to expand in many areas of not just North Carolina, but also in the country. So through our partnership with NCPA, we're identifying many owners or pharmacists out there who maybe perhaps are timid to do the traditional residency program because they're timid because of the paperwork through the accreditation process. However, they want to really train students to be the next generation of pharmacy owners. So we're identifying a lot of pharmacies and pharmacists throughout the United States that are really liking the idea of the IPOR program. And within our partnership in North Carolina, we would love to expand to the mountains, and we'd also love to expand to other areas of the country. And I think Wisconsin and Pennsylvania is just the start, and I think those 3 sites within North Carolina is just the start. We're only in year 2, and we expanded from 1 site to 5, so I can imagine next year if we're invited back to do this seminar, hopefully we'll be up to 10 or 12 sites. So that's really our goal, is to find more sites and more locations with pharmacy owners who have this passion and want to train the next generation of pharmacy owners.
Yeah, and, just speaking on behalf of Mutual and on behalf of our network of pharmacies, I mentioned that we're 600 pharmacies in 3 states, and we cover 99 of the 100 counties in North Carolina. So, we are still growing for sure in North Carolina. I think our Mutual critical mass is probably, in my mind, somewhere between realistically about 5 to 7 pharmacies maybe. And we would like to get a little more statewide coverage as we're growing into new sites. So I think thinking west is going to be on our priority area. We just got to make sure, that we're finding the right partners, especially early in the program. So we don't have any specific plans as of right now to expand into Western North Carolina, but our hope is to have sort of a statewide coverage in this program.
Great, thank you for that answer. Next question is for Alex. Alex, I know your program, you said, is a little bit different because as part of your experience, you get to have some time with APSC. Can you talk about what kind of skills that you've gained from that experience? And what does your day-to-day look like?
Day-to-day it varies. As far as with APSC, you learn... It really you can kind of focus on what your interests are. So if you're really into the legislative process and that's something you think you're passionate about, you can get very involved with it. It hasn't been something I've really delved into yet, but with the Kentucky legislative session gearing up for January, that may be something I'll look into, about 2 months from now. There's the clinical arm, which looks at developing almost, I guess you could call it, sort of playbooks for these pharmacies that are members of APSC that want to develop and implement clinical services. So we can, for example, with me starting MedSync at Wheeler Pharmacy, I'm kind of writing, like a play-by-play kind of thing to give out to other pharmacies that want to implement that, or for pharmacies that want to figure out how to integrate NTM into their workflow or immunizations into their workflow. some of the articles I've written for the monthly newsletter have been centered around that topic. So for me, that's, I guess, more of a management or practice development focus, since that's kind of more what I'm into. But there's such a wide variety that you can really kind of tailor it towards what you want to do. Again, there's no real consistent day-to-day. I typically spend, if I had to average it out, probably 2 to 3 days a week at Home Connection, about 1 day a week in the prescription department. A lot of that's focused on MedSync, and then about a day mixed between teaching, research, work, going to APSC headquarters, going to other state group meetings like Kentucky Pharmacists Association or different work groups we have focused on advancing pharmacy practice.
Thanks, Alex. Our next question is going to be open to the entire group, so we can get both perspectives. For the residents, when you were looking for a residency, how important was location? Did you try to stay and pick a program that was in the state where you went to pharmacy school? And then for the directors, do you see if there's any sort of preference that you make for students with that went to school within your state, or it shouldn't matter where a student completes their pharmacy training?
I'll answer quickly on behalf of the programs. It does not matter at all where you came from. If we think you're the right person, anywhere in the state, we are happy to bring people on board, as exhibited by a new program in North Carolina whose first resident is from Massachusetts.
Yeah, we really go after the most qualified candidate. It doesn't really matter the program or the school that they graduated from. There's definitely no preference. In my 12 to 15 years of being a preceptor/residency program director, I really haven't given preference over schools. I've given preference over the best candidate.
Alex or Nick? Yeah, go ahead.
Okay. As a resident, I spent a lot of my time just really looking into what the program had to offer. It's really, it's up to you if you feel like moving is something that you want to do, or locations, something that you're okay with changing. But for me personally, I just sort of wanted to focus on what the actual program was and what I could bring to that program.
Okay, great. Next question is in regards to the IPOR program, new graduates have the opportunity to make $120,000 a year to pay off debts in order to financially prepare themselves to start a pharmacy. Do you think that the experience of the program is worth the financial pay cut directly out of pharmacy school, even though you'll end up purchasing a pharmacy if that is your goal?
You want me to take that one, Patrick? So actually, let me answer. I wanted to answer the rest of your question, Alex, before about, since you have students on the line, about the geographic region. I will say that I've had students that I've been mentoring that have limited their geographic region because they were limited to a particular area and they only applied to programs within that area. And they have been typically the ones that have been unsuccessful in the match because they limited their geographic region. So a word of, friendly advice or mentoring advice based on experience is that if you are looking at programs and you can expand your geography a little bit more, do it, because typically those that don't match, if you are going through a matching program, it's because you limit your geography. So I just wanted to add that before I answered your question, Alex. So regarding your question about finances then, and is the 1 year worth it? I think that's a personal question that everyone has to answer. With a traditional residency as well as with the IPOR residency or any residency program, whether it's inpatient or outpatient, it's typically that 1 year experience that you do within a residency is equivalent to about 3 to 5 years worth of professional experience. So after that 12 months, you have experience of about 5 years compared to a peer of yours that hasn't done a residency. So our goal, and granted, we're only 1 year into our program because it's new, But traditionally, the numbers are after someone graduates, if they know that they want to own a store, the earliest they can usually do it is like 12 to 15 years after they graduate. Just because of experience, just because of finances, just because of management, just because of lots of the tools that you get through work. And so if you do this residency, you would get about 5 years of management, financial, all the experience that you need to own, and you'd be able to learn a lot more of that. So our goal for this program is to shorten that 12 to 15-year period for if you want to own, to make it closer to 5 to 10 years post-graduation. So I think that that's a question that personally someone has to decide. Is ownership a desire within 5 to 10 years after graduation, or is the 12 to 15 years fine for them for graduation? So that's what I see as the biggest advantage of that, not getting that pharmacist salary right after graduation for any residency. Of what is your long-term career goal, and when do you want to achieve that long-term career goal? Because 1 year of training will get you faster on your track of whatever your long-term career goal is.
Yeah, and I'll just add into that, both sort of speaking from my personal experiences as a resident and where I am now, and also with our program, so that you really, in my mind, yes, that pay cut is significant, and yes, for that year, making what you're making, knowing what you could be making is tough. It wasn't that long ago that I was in that situation, and then I chose to do 2 years of fellowship at that level of pay as well, because I'm in glutton for punishment, apparently. But the connections that you'll make and the experiences that you'll get and everything, you really have to view it as a long-term investment. I would never be in the position I am now if I hadn't made that decision. And I think that with this program, speaking on behalf of Mutual and the things that we are trying to bring this program as a partnership. So, we're a co-op of independent pharmacies that all came together to form a wholesaler. Every single pharmacy within our organization is stronger the more pharmacies we have in our organization. And just like we're seeing nationally, there is about to be a huge need for people to come in and fill in for the owners that we have that are getting close to retirement age. And so, not only that sort of 3 to 5 years of experience is packed into 1 year, but a network of pharmacies who are looking to say, look, I need to get out in 10 years and I need to find somebody who's willing to come in and phase in. I think that those are the types of things that we're looking to connect our graduates to, so they can get there faster. So I firmly believe that it is worth it for the right person. I'll also put that in with a caveat that I don't believe that you have to do a residency to be successful in pharmacy, and I don't believe that a residency is right for every single person that graduates pharmacy school. But if you believe in the opportunity and if it feels right, I don't think that pay cut for 1 year should be a reason to not pursue it.
Alex and Nick, did you want to chime in kind of on that topic as well? Why did you decide to do a community pharmacy residency, and what do you think your prospects are out of your next year after you are done with your program?
Well, I definitely think, this is Nick, by the way, I definitely think that the experience is something that it is hard to find elsewhere without several years. I'm learning a lot about a lot of different avenues of pharmacy and how they all incorporate into one another. That was one of the biggest things that motivated me to do more of a community-based residency, is that I am really learning and beginning to incorporate my own ideas and my own projects into the overall spectrum of pharmacy, and there are a lot of different avenues. I feel like I'm getting a very holistic view of pharmacy, and with community pharmacy, I mean, that's right at the direct patient level. A lot of things we learned about in school, like MTM, those point of care tests that are up and coming, a lot of that is happening at the community level, and the developing healthcare system plays heavily into pharmacy's ability to keep up with that, and that happens a lot at that community retail front. So for all those reasons, I mean, it just, that's what really drove me towards my program and community residencies overall.
Yeah,
Alex?
I can chime in on that too. The big thing for me has been, I'd say, the networking. You get to meet a ton of people that if I were just working a typical 9-to-5 job, I would have no contact with. Instead, I've been to numerous conferences, both in Kentucky and outside Kentucky. So nationally, I'm making connections as well. But I'm also getting a chance. I'm very business and entrepreneurial focused. I'm getting a chance to figure out the finances behind offering services, not only at a pharmacy level, but also looking at, potential new business offerings. So one of the things you do with our residencies, you also write a business plan. And the one I'm working on, I'm basically trying to create a job for myself, which, again, if I had just taken one of the 9-to-5 jobs that were available, that's not something I'd likely be working on during work without getting fired. So that's a great opportunity. It's a unique learning experience that I don't think you get if you're just taking, an average staffing position.
We also had, thanks, Alex. Dr. Olson from Skywalk Pharmacy just left a note that he also completed a community pharmacy residency in 2000, and he opened his pharmacy in 2003, and he said he could never have done that without the residency experience. Now we're just about at time, so I'm going to close with one last question. So if you do have any additional questions, please feel free to contact each of the respective directors or residency program residents individually. You can also find many of them at mid-year. I believe that UNC's IPOR program will be there on Tuesday in the morning, booth 5643 from 8 to 11. UK's program will be there Monday afternoon, 1 to 4 at booth 4305. Nick's program at Fruth and University of Charleston will be Tuesday afternoon, 1 to 4 at booth 6108. And if you're looking for me, I will be at booth 6407 on Tuesday afternoon from 1 to 4. And the final question, we do have some first, second, and third year students on the line, and they wanted to know what are some things that they should be doing now to prepare themselves to be a competitive residency candidate? And this is open for the entire group.
Hey, this is Nick. I just want to answer that real quickly. For my part, really a student at any age, my suggestion would be this, is start thinking about what you're really passionate about. There's different avenues of pharmacy that you can move into. There's different, disease states and things like that. And it's not so much where you see yourself in 5 years, but what do you see yourself doing? What do you want to do? What kind of differences do you want to make? Because that's your big motivation. And when you go to figure out, whether or not you want to get a job or residency or whatever, that's what people are going to be looking for. What is it about you that you're going to bring to those things? And that really starts with you knowing what you enjoy, your passion, and the things that you want to bring to pharmacy.
Alex?
I think Nick hit it right on the head. Know what you're passionate about. When you're in interviews, it'll show. If you're truly passionate about the residency program you're interviewing with. But also say, don't focus too hard on one specific area. Be well-rounded. So, keep your grades up, but also we want to see leadership. We want to see community involvement. And, if there are areas in your resume you don't feel strong about, that's okay, as long as there are other areas that make up for that. So if I'm someone who didn't work during school, and that may have been seen as a gap, but I made up for it in other areas, and I was able to articulate that in interviews.
Dr. Ferrari and Dr. Brown, are you still on the line?
I am. Patrick, you still
I'm here too.
Yep. You go first.
Okay, I'll go first. So I think, so in addition to knowing your passion, I guess I'll give a little bit more of a level of detail too from a faculty or residency program director person when I'm reviewing the applications. If you're interested in a community pharmacy residency, I want to know on your CV, what have you done in the area of community or outpatient? So it could be working in a community pharmacy. It could be involvement in community outreach. It could be, and I don't mean just community pharmacy. I mean like community as a whole. So how are you involved in the community, whether that's through volunteerism or so? Why community? I always wanted to know when I reviewed sort of CVs and cover letters, like what drew you towards community? Why are you so passionate about community, and what experiences have you had in the past that you know that you want to be in community? So I want to see some of that demonstrated on your CV, whether that's through volunteering, whether it's through actual work experience, whether it's through student groups that you have at the School of Pharmacy that are more outpatient or community focused. So I think it's sort of more that community experience through that vast array of ideas and wealth of experiences, and also work and that sort of thing, and also some sort of leadership or management. And I don't mean leadership like an elected position. I mean leadership like working as a team. How do you motivate a team to move things forward? What is how are you going to work in a community pharmacy when you have those people with you? How do you work on a team? So that's typically an interview question that I ask of my candidates. So I just gave you a secret for everyone who's on the call right here. But I also want to sort of see that in your cover letter, and I want to see on your CV different experiences that you've had with working on a team. So I guess if you're a second or third year, just look for those opportunities to get involved in student groups or community organizations so that you have great stories and great examples to share when you get involved on the interview, and that will hopefully help you identify, so that will make you a stronger candidate once you get to the interview process. Patrick?
And on top of that, I think in echoing and agreeing with everything that's been said so far, and try not to repeat those points and add something else, it's never too early to start building your network in pharmacy, and I sort of mean two things there. One, if you haven't already heard it 1,000 times in pharmacy school, let me tell you the first time, and you'll hear it 1,000 more, that pharmacy is a very small world. Community pharmacy especially is a very small world. And that can very much work to your favor, and it can very much not go so well, So keep that in mind even early on in professional interactions with, students that are ahead of you that are on that path, fourth years, TAs that you have, residents that come through to teach classes. Sort of get to know those people and sort of learn from them and pick up on their tips and build those personal relationships. Because, for me in pharmacy school, building all the way up to the point where I pursued a residency was sort of a constant evolution of learning a little more about it from upperclassmen and then from residents and then from site coordinators all the way into being a resident myself. So I think that network really can help you both with connections to sites and getting sort of those opportunities to go to those places, but also in learning what it takes and learning which opportunities will be right for you.
Thank you, Dr. Brown. And with that, thank you so much for your time tonight to all the speakers, residents, and directors, and to the students who were on the line to learn more about pharmacy residencies. You are on the right path and making the right decisions. So I do want to bring your attention to two resources we have. ncpanet.org/residency will shortly in the next few weeks have some more materials from the webinars as well as additional handouts about residency programs. And also to keep up to date with NCPA student events, join the NCPA Student Network Facebook group. And if you have any further questions, don't hesitate to reach out to me. You can reach me at alexander.2@ncpanet.org. And feel free to contact any of the residency directors or the residents that were on the call. And if you need their contact information, feel free to contact me. And thank you, everyone, and have a good night.
Thank you.
Thank you.
Thanks for having me.